Hydatidiform mole. The term hyd, that means water or fluid-filled cavity or sacs. Now it lies in GTD, that is gestational trophoblastic diseases. Now these are the spectrum of proliferative abnormalities of trophoblast. Now the trophoblast are those cells that make up the placenta, and they are of two kinds: the cytotrophoblast and the syncytial trophoblast. The cytotrophoblast make up the chorionic villi of the placenta, and the syncytial make up the lacunae of the placenta. Now it is the abnormality of placenta leading to proliferative changes in chorionic villi, resulting in clusters of grape-like cysts. Now its etiology. It is based upon the phenomenon of androgenesis. That means there is no contribution of maternal chromosomes in a complete mole. Now what happens in a complete mole is the sperm, for example, it is haploid. When fuses after the process of meiosis leads to the formation of 46XX karyotype, that is 85% cases. Now in an incomplete mole, there is 2:1 contribution of maternal is to paternal chromosomes. Now pathology. The death of ovum or failure of embryo leads to this condition. The dead hypoplastic cell secretes the substances, and the maternal blood altogether accumulates in the villi, and it leads to its distension, leading to formation of small vesicles. Now, in the pathology of it, if you will have a naked eye appearance, you will find uterus with multiple chains and clusters of cysts. There will be absence of embryo or amniotic sac. Now in microscopic appearance, you will find proliferating syncytial and cytotrophoblast. In the ovarian changes, there will be bilateral uterine cysts, which is due to very high concentration of HCG. Now clinical features. There will be a history of 8 to 12 weeks of amenorrhea, vaginal bleeding, gelatinous fluid in blood. It will give an appearance of white currant and red currant juice. There will be varying degree of lower abdominal pain due to overstretching because of dividing cells, concealed hemorrhage, proliferation of uterus, for example an invasive mole, an infection, uterine contraction to expel out substances. Now constitutional symptoms. The patient would look sick, vomiting to the extent of hyperemesis in 15% cases, thyrotoxic features like tachycardia, breathlessness due to pulmonary embolism. Now expulsion of grape-like vesicles per vaginum, and there will be no history of quickening. Now signs. The signs would include features of early months of pregnancy. The patient would look ill, pallor due to concealed hemorrhage, preeclampsia. Now in examination, abdominal examination, you will find the size of uterus much more than the size of normal pregnant woman in the early months of pregnancy. The uterus would feel firm, elastic, doughy because of absence of amniotic fluid. There would be no fetal parts palpation and no fetal heart sound heard. Now in vagina, you will feel unilateral or bilateral enlargement of ovary because of lutein ovary, vesical discharge and vaginal discharge, and in cervical os you will be only able to palpate the vesicles and there will be no membranes.